I am Dr. Kimberly Souffrant on behalf of my colleague, Dr. Bevan Cohen. We welcome you to the Translational Research and Implementation Science for Nurses program, informational session, also known as the TRAIN program. So in this webinar, we will discuss a few things. I'll start by giving a broad overview of the program, including who our team is. I'll go over the program objectives and the training goals. And then I'll hand it over to my colleague, Dr. Bevan Cohen, who will continue to discuss more about the format, the structure, as well as the curriculum and eligibility of the program. So meet the TRAIN team. So here are members of our Center for Nursing Research and Innovation, also known as the CNRI at Mount Sinai Health System in New York. I'm Kim Souffrant. I'm the Associate Director of the CNRI. I'm also an emergency nurse practitioner and a nurse researcher. I study high blood pressure and health equity within the context of emergency care. My colleague here, Dr. Bevan Cohen, she's the director of our CNRI. She's also a nurse, and she is an epidemiologist. And so Dr. Cohen and I are the principal investigators for the TRAIN program. Kavita Rampratap, she is a nurse and our program manager. And then you see Tiffany Goldwire. She is our program coordinator, and she brings her expertise in public health, in research. And so the four of us here on the slide are the core members of the TRAIN program team. Program faculty. So the TRAIN program is built around two core components. We have the hands-on, high-impact mentorship, as well as the structured, research-focused curriculum. So in addition to the core members of the program you saw on the previous slide, there are a number of program faculty that support our program. So the faculty mentors, every single mentor within the program were intentionally selected by myself and Dr. Cohen. They're either physician scientists or nurse scientists, and they bring years of experience mentoring students across multiple disciplines as well as training levels, including nursing. Our mentors have diverse experience in research methodologies, including community engagement, qualitative work, clinical trials, and so on. But all of them work in areas that align with cardiovascular science and health equity. And that alignment is intentional because it directly reflects the mission of our funder, which is the National Heart, Lung, and Blood Institute. We have a group of research experts and clinical liaisons. Our research experts, they join us weekly to share their own research projects, their career trajectories, their scientific work, their impact, with their research, and clinical liaisons will help facilitate the research projects as well as provide guidance and support to our students. Finally, we have a number of content experts who will offer specialized knowledge to enrich the curriculum in order to create a pretty dynamic and well-rounded learning experience. So for example, we may have a librarian who will give a talk on immersive literature reviews or critical appraisal of the literature. We may have experts in community engagement who come and share their work, for example, around barbershop interventions to improve hypertension health outcomes in Black men. And so there'll be many experts who share their specialized knowledge on really how to move the needle around evidence translation in the field and the profession. Program objectives. So when we designed the TRAIN program, we were very intentional about the objectives because this is not just a research exposure program, but we wanted to, it's about changing how nurses see themselves within science and shifting your identity and how you see your impact within the space and the profession. So the first objective is really around research literacy. Many DNP students are incredible clinicians, but may have, haven't always been given the tools and the skills, the confidence to really move comfortably between research and practice. And so we focus on really helping nurses not only understand research, but really feel empowered to use it and to apply it in real world settings in many different ways. The second objective is about bridging research and practice. One of the biggest gaps in research or in healthcare really is that we generate a lot of evidence, but it takes years, right, to show for that research to really show up at the bedside. And so we, in the program, we intentionally show students how translational science works, how the ideas move from questions to designing a study or a protocol to implementation, and finally into patient care as well as the community. And we want to really make that process visible and tangible. The third objective is interdisciplinary collaboration. So we don't work in silos. Healthcare doesn't happen in silos, and neither should science. And so we learn what it means to work alongside our partners, whether in the community, our physician partners, and really actively participate within those teams. And finally, we focus on leadership, empowering our future leaders, leadership and health equity. So preparing nurses to lead, but not only in clinical roles, right, but shaping policy, driving innovation, really advocating for our patients and communities that are often left out of the conversation. So becoming a leader in evidence translation and doing it continuously and confidently so that your patients receive the best evidence-based care that they deserve to achieve optimal patient outcomes. And so everything we do in TRAIN connects back to these objectives. They shape the curriculum, the mentorship experience, as well as all of the opportunities that our fellows receive. So training goals. We have 4 specific training goals for the TRAIN program. First is around health disparities. Through the program, the students will learn to understand what that unequal distribution looks like, understand the unequal distribution of health outcomes and access to health and health care among different populations and different groups as it relates to cardiovascular disease. And so we'll discuss a lot of the social drivers and structural drivers that impact health outcomes in some populations and groups. Second is on cardiovascular research, countless evidence-based interventions to improve cardiovascular health outcomes, and we'll touch on some of them, and how to leverage translational research and implementation science to really advance health equity. So not just clinical outcomes, but really how to reach the populations who need it the most. Third is workforce diversity. So the program embraces the importance of a diverse and inclusive healthcare research community to fostering innovation and health equity. Bevan and I believe access to opportunities such as this fellowship is important to really advance health and healthcare equity for all. Finally is translational research, right? Bridging the gap between science and practice, particularly in the context of health disparities and clinical research that is central to the mission of the National Heart, Lung, and Blood Institute. DNP nurse leaders are well positioned to lead this, and so we want to support those with the knowledge, with the skills to do so. And so we'll discuss your role as a DNP, a nurse leader within this space of translational research, and how to leverage the implementation science and the frameworks to advance health and health care. As I mentioned, a lot of the focus will be around heart, lung, blood, or sleep disorders because it aligns with the mission of our funder, but the work and knowledge and the skills that you'll learn is certainly scalable across many conditions as well. So I'm going to hand it over to Dr. Cohen, who will start to touch on the program structure.
Okay, thank you. So TRAIN is a 12-week summer program. It will run from May 26th, which is the Tuesday after Memorial Day, all the way through mid-August, August 15th, 2026, which is a Friday. Train commitment is 30 hours a week, but some of that time is flexibly scheduled. So we are usually able to accommodate people who have, different work schedules, different commitments, and who come from different areas of the country. Train also comes with a monthly stipend and funds for travel. So that includes travel to and from Mount Sinai in New York, including airfare, train fare, lodging for people who are coming from out of state. And we also have travel funds for participating in national conferences and scientific meetings. Next slide, please. So the program includes two components. The first component is our didactic sessions. So we meet together as a cohort 2 days a week for 10 hours total, 5 days each, 5 hours each day. And this is the time where you will be able to meet with the other fellows in your cohort and also meet with dozens of experts from across the country who are going to come to share their expertise with you. And it's really a nice opportunity to engage in discussions, conversations, networking. And we have found that our fellows in previous years have really appreciated that in-person time to, really have the opportunity to discuss issues amongst each other, with myself and Dr. Souffrant and with all of the many, many experts who you will get to meet and connect with throughout the course of the program. So again, that is going to be 5 hours per day on Thursdays and Fridays throughout the summer. There's also a hands-on research component, and this is about 20 hours per week. And this is work that you're going to be doing with an assigned research mentor. So all of our fellows get paired with somebody who is an expert researcher in the field, and our mentors all have ongoing research projects related to the topics that we cover in Train. And what you'll be able to do as a fellow is join them in their ongoing research to work on whatever it is that they, are working on with their research teams over the summer where you're working with them. So depending on what type of project it is and where the project is in the process, maybe you'll be helping to work on literature reviews, maybe you'll be helping to work on, data collection with participants, maybe you'll be helping to, analyze some data or write, parts of manuscripts. So you have a lot of opportunities to really get some hands-on involvement with really, expert researchers and expert research teams. So these 20 hours a week are flexibly scheduled based on what the needs of the team are, and of course, what your scheduling needs are, balancing your work life, your school life, and your home life. So, as part of the interview process for Train after you apply, we will get a sense for your availability and try to match you with a mentor that's going to, have a schedule that's going to suit, your needs. Next slide, please. So now I just want to talk a little bit about what you're going to learn in those didactic sessions. So that's the 10 hours a week that we spend all together. So you will have a lot of curriculum around health disparities and hypertension. And I think you'll find it really interesting because you'll be hearing from experts who, not only are going to discuss the state of the science for hypertension management and control, but also talk about a lot of, key issues and talk about, hypertension management across different populations and thinking about how technology comes into play, how precision medicine comes into play. How do we use the data that we generate to actually take action? So you'll be hearing from, again, experts, within our Mount Sinai community and from across the country on these topics. Next slide, please. You'll also be learning about translational research. So this is, research that really, continues the process of taking evidence and actually translating it into practice and seeing how, we can actually impact patient care in the real world. So you'll be learning the foundations of translational research, right? What is it? What are the different stages? How do we conduct it? And all of the different considerations when conducting translational research, right? So thinking about team science, thinking about how we do evaluations, thinking about how we work within organizations and consider the contextual factors therein, thinking about the cycle of research and where translational research fits into that, thinking about patient-centeredness and how translational research fits into that. So we'll be covering, a lot of topics about the foundations and also the practicalities, of implementing, a translational research program in a health system. Next slide, please. So along with that, we're going to cover some core research skills. And this is really meant to supplement what you are already getting as part of your DNP programs and as part of any previous degree programs that you may have already completed. So we will go through, again, a refresher on how to, do a literature search and how to really frame and hone research questions. We'll talk about different study designs and developing protocols for translational research and other types of studies. We're going to give, some strategies and really practical advice for how to collect data, how to store data, how to read studies about genomics and epigenetics, data analysis, thinking about big data, some of the articles that come across our desk that we need a little bit more foundational knowledge in order to, really read and interpret and apply. We'll also be, giving a lot of instruction and discussion about how do we disseminate the work that we've done in the clinical setting? How do we write for publication? How do we, write abstracts for our, nursing audience and interdisciplinary audience? How do we present findings to the general public? So we'll be talking a lot about these core research skills that you can apply broadly to wherever it is that you end up working. Next slide, please. And we will also be talking a lot about the responsible conduct of research. So in addition to thinking about sort of the history of the IRB or the Institutional Review Board and why we have the Institutional Review Board to guide the ethics of research studies, we'll talk about some of the practicalities of navigating the IRB in today's world. And we'll also talk about, really important tenets of research integrity, avoiding research misconduct, understanding what we read about research misconduct in the press, and also thinking about some, considerations for, special populations that we really want to make sure we're providing, additional ethical scrutiny, when we're thinking about what research we're doing and the types of research that gets approved. Next slide, please. So this is just a small sample of some of the amazing talks that you will hear throughout the course of this 12-week summer program. As you can see, you will be getting the opportunity to meet with dozens of expert researchers who are leading the way in the field. So just to pick out some of the many interesting talks that you'll hear, thinking about how language barriers could affect access to care, thinking about racism, stress, and epigenomic changes that can cause preterm birth in Black women, thinking about special considerations for cardiovascular health outcomes in the LGBTQ communities, or cardiovascular disparities in deaf and hard of hearing populations. So many different, interesting, studies and interesting programs of research with, all of the many populations that make up our U.S. population and our U.S. health system. Next slide, please. Similarly here, you're going to hear a lot of talks about how to build your foundational knowledge and skills, right? So how do we use data to drive health equity? How do we select the right design and method for the type of project that we are considering? How do we apply, the PDSA cycle in a real world application? These are, some of the many topics that will, dig a little bit deeper into the hands-on, practical how-to of trying to do translational research in the health system context. Next slide, please. So another wonderful thing about the TRAIN program is getting to have the opportunity to chat and network and hear from, the many leaders, in the field who are, advanced practice nurses and DNPs, who are really out there, making an incredible difference, in their leadership roles. So, for example, Danielle McCamey, who is the founder and president of DNPs of Color, has generously come to, meet with the TRAIN fellows, each year, and, really share not only about the amazing work that she's doing today, but also her journey of how she got to her current role. Similarly, Carl Curtin, who is the editor-in-chief for the American Journal of Nursing, comes to share all about AJN and the publication process, and also shares a lot about his journey throughout the course of his nursing career, to his present day role as editor-in-chief of AJN. So it's a really nice opportunity, to really get, a personal, connection with, these incredible leaders. Next slide, please. And did just want to mention, some of the experiences that our previous cohorts of fellows have had in the TRAIN program thus far. Many of our fellows have contributed to abstracts that have been presented at national conferences. Several of our fellows have contributed to, publications that have been, published in peer-reviewed journals. We always do a pre and a post self-assessment of knowledge, attitudes, and practices related to research. And, we generally see a big change from beginning to end in terms of, understanding and confidence, in research methods. And overall, we're really happy to hear that people have a positive experience learning both from the experts that you get to meet along the way, but also really gaining community with your cohort, of other fellows who are your peer DNP students and your, future cohort of colleagues as you, enter the workforce as a DNP. Next slide, please. So lastly, I'll just talk a little bit about program eligibility and the application process. As was mentioned earlier in the presentation, this program is funded by the National Institutes of Health. So per the rules of the funder, this program is open to U.S. citizens or permanent residents. Program enrollees must be in an accredited DNP program from the beginning of the program to the end of the program. So from the end of May through August, through the mid-August, you should be enrolled in a DNP program at that time. You could be early in your program, you could be later in your program, but you have to be enrolled during the training period. The TRAIN program is designed specifically for students who are members of communities who have been historically underrepresented in science. And if you have any questions about eligibility, you can feel free to reach out to us at our TRAIN inbox, and the information will be available to you at the end of this slide. Lastly, how do you submit an application? Our applications are due by February 17th, 2026. You'll be able to find the application website online using the QR code at the end of the presentation. And I'll tell you a little bit about what you'll be asked to provide in the application. So the application includes your demographic and contact information, your CV or resume, a 500-word personal statement that really describes your specific interest in translational research and your career goals related to mitigating disparities related to the NHLBI's primary areas of focus, which include heart, lung, blood, and sleep disorders. You'll also be asked to give 2 letters of recommendation that specifically discuss why you would be a good candidate for a training program that is focused on advancing translational research in the practice setting. You'll be asked to provide a transcript from your DNP program, and we will accept either an official or an unofficial transcript. And lastly, we will ask you to have your institution, your school, sign a attestation just stating that the train program is feasible and compatible with your coursework and your school expectations. And this attestation form can be signed by your DNP program director, the chair of your department, or the dean of your school. Next slide, please. And lastly, this is our contact information, so you can email us anytime with questions. The email address is train@mountsinai.org. You can also visit our website by scanning the QR code, and on the website you will find the link to the application, some basic information about the program, and of course more contact information to reach us at. So we welcome your questions anytime to the Train inbox. Please feel free to reach out.